Hi everyone. For all those of you who are wanting to be successful in the MRCPCH clinicals, I just thought I'd share a few random points which over the last 10 years or even 15 years I've noticed matter and make the difference being successful in the MRCPCH clinicals and for those who are not successful in the MRCPCH clinicals. Over and over I've seen the same points, which make the difference between a successful candidate and those who are not successful. Hi, I am Dr. Pavitra Chakravarti. I'm one of the founders of Dr. Academia, a place for where we do training for MRCPCH Clinical, and I would really feel great if some of my observations help you in your preparation. The first thing when you're starting your preparation for your MRCPCH Clinical, get it into your mind that this is more of a like preparing for an Olympic marathon. It's not a overnight sprint. It's not something which you can just do a quick tactics or a quick shortcut and get away with it. You have to get in your mind that you have to be preparing this. You have to be a regular practice so that with a period of time, these habits, these skills, these clinical skills, these methods of speaking, the communication skills, the art of taking history in a very short time, these become ingrained in your system so that by the time the actual exam comes, it will flow from you. It will come automatically. So there has to be a regular system. It's a long-term marathon and you will get there. Number one. Second one is it's a sort of repetition of the first point. There is no getting around the fact that you have to do practice, practice, practice. The people who are practicing more are the ones who are going to be successful. Think of Tendulkar and crickets. Why is he so successful compared to anyone else? Is it a magic, or is the fact that he has had probably more practice than anyone else you can think about? So same, if you practice more, you are diligent, it sounds very predictable, but you're going to do it. The third one is learn and practice the art of speaking slowly and legibly. Including myself, I used to speak very fast. Even now, I've got a tendency to speak fast. But in the exam, if you're not audible properly, if you're not speaking slowly enough so that or you're speaking with authority, this makes a difference whether you will pass or not. Okay, a lot of candidates I find, they're speaking such a low voice and they sound so much as if there's just no confidence in their voice. We all know, we've all been there. It is difficult. We are feeling nervous, but get into the habit of practicing so that your voice is in the right tone, it is audible, and you sound confident. It will make a difference. Okay, so this is what you need to do really. The other point is get into the habit of recording yourself on video. Get into the habit of, even if you've got a pillow, and practicing a system, maybe even a CNS system or a gastric GI system. Get into the habit of doing the regular examination. Time yourself, whether you can do it in 5 minutes, and see if you're getting the sequence right. Get someone to record you. Or even if you're doing a simple breaking the bad news, record yourself. I know initially when I did it as well, I used to cringe. I'm not a big fan of looking myself in my videos, and initially you will just not like the idea of seeing yourself speaking on video. You will say, how bad am I? That's a very common scenario. Everyone feels that. But over a period of time, you will realize where your difficult points are, which are the points where you need to improve upon, and you will get better. So like I'm doing right now, get the mobile phone out, record yourself and see how you're doing. See where your points, where you're faltering, and try to correct yourself. If required, share this video with your seniors or those who pass the exam and ask them for their open feedback. Also, get into the habit of being aware of your body language. The Royal College examination is not about only knowledge. It's also about showing the right respect towards the patient, having etiquettes, the proper etiquettes, and also a lot about what is not so. It's also, especially in communication skills, especially when it's a question situation of bad, showing empathy, breaking bad news. It's a lot of body language. It's a lot of knowing where to keep silent, where knowing where more. It's more about listening rather than speaking. So get into the habit of knowing that, where to speak, where to pause, what's your body posture, how are you looking to the patient. You never look down on a patient, you look at the same eye level. There are lots of more things about body language which you need to know. And again, lastly, I would say that get into a system. All right, get into a system that, okay, every day I'm going to do one system which I'm going to practice. At least I'm going to do one communication system which I'm going to practice. There's one developmental situation which I'm going to practice, even if it's very briefly. Get into the habit of doing that, within 10 minutes or so that you become fluent with that. I would say one more bonus point, which I have found, a lot of candidates recently have found who are very successful. What they have done is go through the recalls. The recalls means basically most of the candidates from exams who are giving exams all over the place in Arab, UAE, or UK, or India, or Malaysia. They're kind enough to share what is the communication scenario they had, or the history scenario they had, or the clinical scenario they had. If I were you, I would make a list of points and go through each scenario which people have noted, and jot down what you would, what are the important points you'd like to cover in that scenario. And if you go by this system by system for videos, people will normally have, if those who have given the exam, they would have noted down what videos they saw in the exam. They may not know the diagnosis, at least they will describe. So go through a list of possible videos which could come, or which you've seen other people posting in the internet. So it could be a croup, it could be a heart murmur, it could be a someone having jaundice, someone having what do you call maybe cardiac scars. So go through the whatever, when you like it up like a project where you go through, maybe if it's videos or it is different communication scenarios, make very brief points. Type it down, make a list. You required work in a group and make a list of these where you systematically cover these, whether it is history, whether it's communication, whether it's videos. And believe me, it will help you a lot during the exams. Well, I hope these small points help you. These are the points which I've found over a period of years, which have made a lot of difference between candidates who have been successful and those who have not. So best of luck to you, and I hope this puts you in the right frame of mind. And these small points, if you can go through them, I'm sure it will make a difference to your in your practice and also in your exams. Thank you and best of luck.